Hello everyone, this presentation is prepared for HAP730 class, Project 5. The topic is root cause analysis of medical errors. I give the permission for posting of this presentation to the class website. Background and problem description. According to a study from Johns Hopkins analyzing medical death rate data over an 8-year period, more than 250,000 deaths per year are due to medical error in the United States. It surpasses respiratory disease, the third leading cause of the United States, which kills close to 150,000 people per year. It was also highlighted by the Institute of Medicine that deaths resulting from medical error existed, those attributed to motor vehicle accidents, breast cancer, or AIDS. Top-rated causes of death, such as cancer and heart disease, get a tons of attention. However, the problem of medical error doesn't get the funding and attention as it deserves. Most medical errors represent systematic problems, including poorly coordinated care, fragmented insurance networks, the absent or underuse of safety nets, and other protocols. In addition to unwarranted variation in physician practice patterns that lack accountability. The expert that I interviewed is the executive director in a not-for-profit health organization. She has many years of experience in health administration. She also actively interacts with many physicians and specialties in the Northern Virginia area. Questions follow the recommendation of the Joint Commission to evaluate a sentinel event, such as examine the systematic process, human factors, equipment malfunctions, environmental factors, uncontrollable external factors, organizational factors, staffing and qualifications, communication, etc. Some other questions that were also asked to the expert are to estimate the probabilities and check assumptions of conditional independence. For example, out of 100 people, what is the probability of people who had medical errors? Out of 100 people, what is the probability of people who did not have medical errors? Throughout the discussion, we considered the medical errors generally result from the improper execution of a plan or improper planning of a method of execution. It can also occur during preventive care measures. For example, if a provider overlooks a patient's allergy when administering medication. There are some main causes of the medical error that can occur, including direct causes, such as unclear verbal or written information, insufficient equipment, poor lighting, fatigued nurses, and some indirect causes including completed handoffs, poor environmental condition, and inadequate staffing. A root cause analysis can provide a beneficial resolution for healthcare professionals and patients to further understand and avoid medical error and prevent future occurrences. A flowchart for causes and effects on the adverse events is shown here. We can see there are direct causes, and the adverse event. And then I made the same causal model for analyzing medical errors in the software Netica. Assumptions and validation. So each node and its associated probability is based on the expert's opinion. Marginal and conditional probability are also estimated. Each node has only two outcomes, which are mutually exclusive and exhaustive events. Some example of the questions, such as if the distribution of staff is sufficient to ensure health, safety, and other goals, will that change the probability of medical errors? If the physical environment is supportive without lighting problems, does that influence the expectation of the probability of medical errors to occur? What do you think is the probability of occurring medical error when there's incomplete hands-offs and unclear information? The experts acknowledged that the assumptions of cost and technologies are accurate. So we can see the probability is entered in the Netica software, and we also connect the network between each node. So there are three scenarios. The first scenario, we estimate the probability of medical error when there is incomplete hands-offs with poor environmental condition and the staffing level is inaccurate. We can see there's a 65.5% of a probability that medical error will occur. And then second scenario, we change the probability of the direct causes. So when there is incomplete hands-off and unclear information only, the medical error, there's a 54% chance that medical error will occur. And then the third scenario, when there's incomplete hands-offs and unclear information with poor environmental condition, also inadequate staffing cause nurses to be fatigued. There's a 72% of a chance that medical error will occur. And then lastly, we did the reverse prediction when we make the medical error 100% sure to be occur. We can see that inaccurate staffing contribute the most probability for the events. Conclusion. The model shows several main causes for medical error, but does not include all causes. Also, compared with the JCAHO's report on the most frequently identified cost route for sentinel events, the model has the same conclusion that staffing level and communication contribute the most frequency for the sentinel event. The expert agrees that model is face valid, but suggests that future models should include more detailed causes. And the rest is my references. Thank you.